Hi, it's Dr. Kostelnik with Rooted Behavioral Education. I wanted to continue the inflammation talk and talk about a little bit about things that have helped me personally. So what things contribute to inflammation? Diet can be a big one. So if we're talking about the standard American diet that has a lot of processed food, a lot of sugar, so causing a lot of blood sugar spikes up and down, that's pro-inflammatory. Chronic stress is pro-inflammatory. Not sleeping well is pro-inflammatory. Sedentary lifestyle is pro-inflammatory. So some things that have helped me have been to focus on, and there's actually a study on this on, I believe it's classic migraine, looking at increasing the ratio of omega-3 fatty acids to omega-6 fatty acids, meaning you want more omega-3. And those are found in things like fatty fishes, low mercury fatty fishes like salmon or sardines, whereas omega-6s I think are more processed food. I think red meat as well. So that's another connection between migraine and inflammation. Focusing on stress management is so important. Sleep hygiene, so important. Those are things that I really take very seriously and things that I prioritize teaching you guys through my courses and through my content. Exercise is anti-inflammatory. And then there's certain nutritional compounds that have gotten a bit more research support lately, omega-3s being one of them, curcumin being another, that's the active ingredient in turmeric. Resveratrol is another one I've seen a few studies on. And lastly, I wanted to share about a medication that, again, it hasn't been studied on the vestibular population, so this is getting kind of away from the evidence-based approach, but it's been very helpful for me. I typically don't like to talk about medications because I find that people gravitate more towards medications than behavioral interventions, and I think it's all important. But the behavioral piece is what is my expertise, so that's what I tend to focus on. But one thing that's been really helpful for me has been a medication called Lowdose Naltrexone. And naltrexone in its, I guess, more conventional form is used actually for addiction. So if someone were to take naltrexone in a higher dose and then to use some sort of substance, it acts as an opioid antagonist. So it blocks opioid receptors, so you won't get that same high feeling from using whatever substance it is. So in that way, it makes the person less likely to want to use that substance again. But in very small doses, we're talking usually people start around 0.5. I think the max dose is maybe 4.5 milligrams. It still works as an opioid antagonist, but it has a pretty short half-life, meaning it doesn't last in your body that long. So it blocks opioids, which tells your body to create more natural opioids. Also, you might know of them as endorphins, which is anti-inflammatory to the brain. There's something called microglia. It's a cell in your brain that can be pro-inflammatory. And so low-dose naltrexone, or LDN, can help to dampen that. And I noticed for me, using more conventional medications and behavioral techniques and all of these things got me to maybe like 90 or 95%, but I still had that background dizziness that felt like it was really hard to shake. Like I wasn't really having migraine attacks too much anymore. I was still very functional, but it was just kind of that background, more annoying rather than debilitating. And I found that when I started this medication, that went away quickly. I mean, maybe within a few days. It worked really quickly for me. So again, this is not medical advice. I just want to be totally transparent and share with you guys some things that have helped me because I've done so much research on this. Just so you know, this is usually coming from a functional medicine doctor, someone who can prescribe. So that would be an MD, a DO, or an ND, medical doctor, doctor of osteopathy, or naturopathic doctor. And it's not a medication you can get in a regular pharmacy. It has to be compounded. So you'd have to go to a compounding pharmacy, and it is out of pocket. At least my insurance doesn't cover it. But I wanted to give you an overview of some things that have helped me. So if you have any questions, I'm happy to continue a dialogue. You can find me here, meaning Instagram, YouTube, Facebook, or at rootedbehavioraleducation.com. If you have more questions about behavioral stuff, that's really my area of expertise. You can check out my courses. I'll see you later.